Good afternoon. We're going to go through an update today, and I'm going to take this community through some detailed raw numbers, the most detailed that we've gotten so far. But let me start with the reports on our major events. We are now upwards of 6,000 tests scheduled at the fairgrounds. We're over 800 a day. We'll be at 1,000 a day by Monday. I know I keep thanking people, but I have no idea what we would have done were it not for Quicken. They are handling that call center, taking 1,500 calls a day, scheduling the appointments. It is the smoothest running drive-through center in America. And to Dan Gilbert and the team who have made it so easy for us, thank you very much. And Roberto Romero, the doctor at the PRB, who came through with another 6,000 test kits for us to keep us going. All across America, people are scrambling for test kits, and Dr. Romero has been our guardian angel, and we have another week's worth of test kits thanks to him. We aren't going to spend a lot of time talking about DPD or Detroit Fire Department staffing. We now have 450 cops and firefighters back on the job, almost entirely because of the 15-minute tests. Assistant Chief White told me today they're returning police officers back to their special units. They had pulled them off to make patrol. Now we're getting enough patrol officers back. We're returning people to their units, and we're getting closer and closer to regular operations. And so what was an extremely difficult situation a week ago in police staffing in particular is now very much heading the right direction. We're testing 127 Ddot employees today at the 15-minute test site. We'll have 400 tested this week, and so our drivers and our mechanics will know that if they have COVID-19, we will get them the proper care. But we'll also let them know that those who are negative, we can also get them back to work. And for those who have family members at home that might be compromised health-wise, we have the hotel rooms at both the Greektown Casino and the Hilton Gardens available so they don't have to worry about taking any infection home to family members. What I want to do now is take you through some detailed raw numbers. Probably for most people this is going to seem pretty nerdy, but I want folks to understand the kind of data that we're looking at. And we haven't been talking about it because the way tests are being done, there are so few tests being done, and the way reports are coming in, it isn't necessarily reliable. Checking infection rates is meaningless. It's only the number of tests. So we have 5,500 Detroiters who have tested positive, but we know that's only a function of the testing limits. But when it comes to deaths from COVID-19, that gives us a real sense of where things are going. But even in that, the data isn't all up to date. Just before I came here, we got a report of somebody who had died on March 31st, came in today on April 7th, because what you have is the tests in the hospitals are taking so long that somebody could pass away on March 31st. They hadn't gotten their test back yet. The doctors assumed they were COVID-19 positive. That test isn't a priority, and so we may not see it until a week later. So the data I'm going to show you is continually in flux and is somewhat out of date. But I think at this point we have enough of a pattern that we can give you an idea of what's going on. And so I'm hoping that the cameras can zoom in sufficiently to see this. But could you step over just, that's perfect, thank you. And so what we have here are the daily totals of Detroiters, our neighbors who have died from COVID-19. So the first day we had a recorded death, March 18th, 2 died that day. We had a total of 2. And then you can see as the day goes along, on the 19th we had 3 for a total of 5. When you are looking at an epidemic, What you're looking for is how fast it's spreading in the community, which means how many days does it take for the spread to double. The rate of doubling is your earliest indication of whether it's getting worse or it's getting better. So let me show you. On March 25th, which I've changed to red, we had one person who died that day. We had 24 people total in the city. And so you say, how long did it take for us to get from 24 to double to 48? And if you can see the screen, you can see that it was 2 days later, March 27th. The number of Detroiters who died in that part of March were doubling every 2 days. That's a horrifying rate for any pandemic. But we have been engaging in it as a community in social distancing. We've been telling you if you stay home, if you stay away from people, we can slow that down. And I want you to see some early results. And so March 26th, I changed to purple. 36 people had died as of March 26th. How long did it take for that to double? You can see on March 29th, we had 73. It had doubled in 3 days. It was slowing a little bit, still a horrible rate. And then if you look on let's talk about March 29th. We had 73 on March 29th. How long did it take for that number to double? Well, you can see on April 2nd, we had 147. It doubled in 4 days, starting to slow. This is what we're attempting to do. And then April 1st, we had 125 of our neighbors had died. How long did it take for that to double? Well, actually, today, we still haven't doubled, and we're on 6 days later. So now, what we're seeing is the rate of doubling is slowing to every 5 to 6 days. This is what we are trying to accomplish, and what we are doing is starting to work. This is the first glimmer of light we have seen from the data since this pandemic started. The storm's not over, but for the first time, we can see we can beat this, and we can beat it in weeks, not months, if we keep doing what we're doing. However, if the weather warms up tomorrow, and people go back outside and cluster in groups, this will very quickly rise back to doubling every 3 or 4 days. Except now, we won't be doubling from 10 to 20 Detroiters, we'll be doubling from 200 to 400 to 800. We are at a time where I think we may be bending the curve, but we're at a very dangerous time if we don't stick with what we're doing. And so I wanted to share this because in a way, and we're going to post this continually, and you're going to have to be patient with us because these numbers are going to continue to fluctuate even back a week or two ago, but we'll honestly post the latest numbers that we have. But in a way, this is a report card. It's a report card on me. It's a report card on the police officers that have been breaking up these groups. It's a report card on the doctors and the nurses in this community. It's a report card on the elders in this community who have gone out to their neighborhood parks and told the kids to knock it off. And I'm hearing that story over and over. It's a report card on all of you who have said to a grandson or a niece or a brother or a sister or a cousin, don't go join that group. You're putting us all at risk. This is a report card on everybody who stuck a mask on this morning before they went to the grocery store or got on the bus. Social distancing in the city of Detroit is starting to work. Now, we have some really bad days ahead of us. We're going to lose a lot of our neighbors in the coming days. It's going to get worse before it gets better. But we can beat this if we keep doing what we're doing. And I want to say again to everybody in this community, you know, every time a group, and by now we're tracking them on social media and the police are breaking them up quickly, every time a group gathers in the city and it goes on Facebook, it gets a lot of attention. What's not getting attention is the people across this city that are very firmly saying, don't you realize that the fatality rate for African Americans is 2 or 3 times what it is for Caucasians with this virus? The racial health gap in this country is being exacerbated. We have to care for and protect our neighbors, and that means wear your mask, don't go out if you don't have to, and watch out for the other people in this community. One of my biggest issues, and I mentioned this the other day, is the buses. And while we have taken significant measures to protect the drivers, we still have people clustered at the backs of buses who absolutely have to go somewhere to get to an essential job, to take care of a loved one. We have asked the transit police to step up enforcement. If there are people who just get on and ride to the end of the line, we're going to start to deal with that with the transit police. But the great majority of people who are on the bus are there for an essential reason. They have to be there. Yesterday, Denise Fair did a video on how to make your own mask, which has gotten 22,000 hits and gone viral. And I'm told today there were far more masks on every bus in this city than we've seen before. But that wasn't enough. So I have been working with the governor, and she came through yesterday with 20,000 surgical masks. And because Governor Whitmer backed us on this, we had to get masks that weren't needed by the hospitals. The hospitals had to have the first priority. But these were masks that weren't needed at the hospitals, and we are now going to start tomorrow by making them available on the buses as you get on, so that we ask every single rider, if you don't have a mask before you get on the bus, please take one. And the person who has been driving a whole lot of our successes, from everything from the fairgrounds to our Ddot response, our Chief Operating Officer, Hakeem Berry, will talk to you about what you can expect to see on the Ddot buses tomorrow. Hakeem?
All right. Thanks, Mayor Duggan. We've asked our hard-working team at Ddot, you will see this effective tomorrow. So we're going to have a box of surgical masks just like this fastened to the end of the bus. So as the passengers board the bus, they'll see this box along with a sign and a request to please take one. Now, we know that supplies are limited, so if you already have a mask or you have access to masks, we ask that you please refrain from taking it and allow the passengers who don't to take one of these masks. Also, as recommended by even the CDC, you don't have to throw your mask away immediately after use. You can wear it again until it's soiled. And for that, what's recommended is a brown paper bag. And I do the same thing, so I usually keep my mask for several days. And at night, I just put it in a brown paper bag, and I'll refrain from wasting a mask, but I just put it in a brown paper bag at night, and I close the top and let it breathe, and so that I can reuse it the next day. And that has been appropriate. So these will be fastened to each bus tonight, and you'll see this sign. Please take one.
All right. We have the ability now with the 50-minute tests to turn our attention to the most vulnerable of all of our citizens, and that's the men and women living in nursing homes. We have 27 nursing homes in this city. 14 have reported some rate of infection, and we have 12 reported deaths. And the health department has been working very closely with the nursing homes to immediately isolate those individuals who are showing symptoms. But when it takes 5, 8, 9 days to get a turnaround on a test result, it makes it very hard for the nursing homes to isolate people quickly and correctly. And it also makes it hard to keep your staff, because you end up quarantining employees who don't necessarily need to be quarantined, but you just don't know and you have to be safe. And so starting tomorrow, we are going to start to use the 15-minute Abbott lab tests to aggressively go after infections at the nursing homes. We're doing that in 2 ways. We're going to start testing nursing home staff at the 15-minute site. We'll be testing 60 over the next 2 days. But we can't bring our elderly residents in for a test. And so what Abbott advises us is that we can actually go out to the nursing home, and Wayne State University has been terrific. The medical students from the Wayne State Medical School are going to go out to nursing homes, and we're going to do one nursing home a day, starting with the ones with the most problems. And here's what will happen. The medical students will go out during the day. They'll take the samples of every nursing home resident that day, and then after 9 o'clock at night, when our testing lab shuts down from bringing live tests in, our medical students and team will stay till midnight or 1 a.m. They'll run the tests after the office is closed on the nursing home residents, so that first thing the next morning, our nursing homes know exactly which of their residents are negative and which ones are positive to allow us to respond much more quickly. And Denise Fair and Dr. Ramon have done a terrific job in figuring out how to take the night hours of our Abbott Lab tests and use them to protect the nursing homes. 2 other points, and then I'll turn it over to Denise Fair. This weekend, of course, is Good Friday and Easter. We have our 6 nutrition sites where we're giving out food at some of them on Tuesday, Wednesdays, and Fridays, some 5 days a week. We won't be operating this Friday. And so we will be giving out more meals to get you through the weekend. So if you are at Crowell or Lasky, if that's where you go, Wednesday will be the last day this week, and they will give you 4 meals for the weekend. If you go to any one of our other 4 sites, Thursday will be the last day this week, and they will give you meals for the weekend. So just be aware, if you're picking up meals for your children, we won't have meals being passed out on Friday, but you can pick them up the day before that. And one last thing is I want to thank our signing team, which have been truly remarkable. I know sometimes we speak too fast, but you have been absolutely terrific in making sure that everybody in this community is able to get this information. And with that, I'll turn it over to our Health Director, Denise Fair.
Thank you, Mayor. I always want to begin by acknowledging all of those who are working really hard every day to make sure that they are helping us fight against COVID-19. I also want to echo the mayor's comments about the Wayne State medical students. These are students who are giving their time. They are volunteering 14, 16-hour days. While we're sleeping, they are still working because they are so committed to the city of Detroit. So I really wanted to acknowledge them. And I also want to acknowledge our residents who are listening to us and listening to our guidelines. And so I also want to acknowledge all of our families whose loved ones have been impacted. This is a hard time for all of us. So as of today, there are 5,501 confirmed COVID-19 cases right here in the city of Detroit and 221 confirmed deaths. Now this is 469 more cases than I reported yesterday, including 25 more deaths. Now this news is indeed somber, but I am here to say that we can do even more to flatten the curve. And again, it takes a village, and we all need to be responsible to do our part. Now, as we are doing a lot in this community, again, it's going to take everyone to be responsible and to follow the guidelines that I'm sharing every day. Social distancing, we talk about this quite a bit, and it can be a foreign term, but essentially it means that we are separating ourselves 6 feet apart from each other. And that will really help to make a difference in the numbers that are being reported every day. Now, the City of Detroit just placed a really interesting infographic on their Facebook pages, and I encourage everyone to look at it. And it discusses the do's and don'ts of social media. So I'll just repeat what was shared. So don't do the following. Don't don't use the playground equipment. And the reason why is because what we found is that the virus can stay on a surface for many hours and many days. So we do not want you to use the playground equipment. We don't want you to play basketball or any type of contact sports. And also, when you are passing someone, please make sure that you observe the 6 feet distance guideline. But you can do a lot. So please do the following. Go outside, bike, walk, run, get some fresh air and exercise. You can enjoy your time outside safely and freely. But just remember, again, to practice keeping yourself 6 feet apart from yourself and others at all times. Now, the number of deaths reported will continue to climb if we don't practice social distancing when you're out and about, when you're out walking, when you are even shopping for essentials. And also staying at home. Staying at home is key to helping slow the spread of COVID-19. Now, as the mayor indicated, the temperature outside is going to be changing. Tomorrow it's going to be 65 degrees, and we'll be tempted to just get back into our regular routines outside. But I urge you to make sure that you practice the guidelines that we have been sharing, because this is our new reality. So if you do go out into the public, we're now recommending you to wear a mask. Yesterday, I demonstrated how easy it is to just have an old t-shirt or a scarf using 2 rubber bands. You can make your own mask, because you could be extremely healthy, but also be a carrier and not even know it. Again, we all must do our part. The behavior of all Detroiters matter, and it has a direct impact on the numbers that are being shared every day. I have faith in all of you as Detroiters. We have a long way to go, but I know we are going to get there. So let's please continue working together to help each other. And if you are, again, feeling overwhelmed, sadness, full of anxiety, please do speak to someone to ensure your mental health is also cared for. Again, please stay home and stay safe. And with that, I'll turn it over to the mayor.
All right, anybody have any questions?
Good afternoon again, Mr. Mayor. Jim Kurtzner with Channel 7. We got some startling figures last night. Beaumont Healthcare, 1,500 workers testing positive. Henry Ford Hospital, in excess of 700 workers testing positive. Those numbers continue to go up, and these are frontline personnel with the protective gear. What are your thoughts, concerns, and even fears about that moving forward?
You know, I ran a hospital system, and I never admired a group of people in my life more than the men and women who worked at the Detroit Medical Center. And, you know, they face risks from communicable diseases all the time, but nobody has ever seen a risk like this in our lifetime. And I would say the way we honor them is to stay home, or when you're out, wear your masks and respect them, because they're putting their lives on the line. They know it. They're putting their lives on the line every day they get in the car and they head for work at Beaumont or Henry Ford or St. John's or Trinity or DMC. These doctors and nurses and the transporters who push the wheelchairs and the nurse assistants who are changing your bedpans, they know they're putting their lives on the line, and they just deserve enormous gratitude from us.
Having said that, you have 2 field hospitals who are being set up, or which are being set up. One down the street could be by the end of this week. Is there a concern about having a shortage of these healthcare workers, not only in the hospitals with the numbers that we're seeing now, but also a shortage for the field hospitals that are close to opening up?
You know, I talked to Wright Lassiter at Henry Ford at great length about this today, and talked to Audrey Gregory at DMC yesterday. We are lucky that Henry Ford and DMC have both significantly expanded their lab testing in the last couple of weeks, which means they are testing their own employees and getting them back. So they're in a far different situation than they would have been a few weeks ago, in that they know who's healthy and who's not, much like what we've done at the police department. And so we will see what happens. The plan is for the lower acuity COVID-19 patients to go to the field hospital, those who maybe are off the vents, are getting better but aren't quite ready to go home, the low-risk patients. And if this is done right, and I think the way that the governor and the team are conceiving of it is exactly right, what they'll do is take the low-risk COVID-19 patients out of the crowded hospitals, move them to the field hospital at the TCF Center. And my guess is in the next week or two, you will see that happen. But for now, I've talked to the hospital CEOs. They believe that this is going to be a manageable situation.
Just to follow up, having said that, we're not going to run out of healthcare workers. Is that the message?
Again, the governor is driving this, but from what I'm hearing, they believe that they will be able to staff up. They're not going to open with 1,000 beds overnight. Nobody could do that. But could they open with 100 beds in a week and start to take some pressure off and then ramp up as they go? I think they can. So from what I'm hearing, they're going to have the ability to open and phase it in a piece at a time. And I direct you to the folks at Henry Ford who are driving this or somebody on the governor's team. They're consulting with me extensively only because of my background in hospitals, but I'm very impressed with what I'm hearing about the way they've approached this TCF Center. I think it's a good plan, well conceived, and I think it'll take the pressure off the hospitals. They're doing a really good job right now, at least the Detroit hospitals are, of sharing with each other who has beds, and as they call it, load sharing. And it's being managed reasonably well today, but if in fact we double, and I showed you we're doubling every 5 or 6 days, even if we double again over the next 7 days, it's still likely to be more capacity than the hospitals can handle, and there probably will be a need for the TCF Field Hospital, and I'm staying on top of it literally every hour. Okay?
Okay, this could be for Mayor or perhaps Mr. Barry. We've got a few questions on Ddot. First one is regarding...
Did you call him Mayor Barry?
No, Mr. Barry.
Okay, sorry, I thought you got promoted. Okay, go ahead.
It wasn't a Freudian slip. First question was, are there any concerns about the sanitization of the masks if multiple people are reaching to the same container to get the masks? Are we concerned about contamination there?
Right, so I want to pull one out so bad for you, but I don't want to risk it, but the way you pull it, you pull one out. It's like a tissue, and that's the way the box is designed. It'd be pretty obvious someone tried to squeeze their hand in there because they would tear the box off, but you can just pull one out at a time.
Okay, and are there any concerns as well, or how would we prevent people from grabbing multiples?
That is a concern, and we always have our transit police on standby. We've been monitoring the riders, and most of them are actually wearing masks, so we hope that there won't be a need to grab the whole box, but we will monitor that starting tomorrow and see how it goes, and if we have to put more measures in place.
But that's a good point. We're going to ask Detroiters, please take one, put it in the paper bag and store it, because we only have a limited number of these. The hospitals have priority in the surgical masks. That's the way it should be. We're not taking any masks unless the hospitals are fully supplied, but we don't have that many for the public. And so it's really important that you take one, you store it, you keep it for as many days as you can, or even better than that is make the kind of mask that Denise Fair demonstrated yesterday. But we're going to have to ask the public again, be considerate of your neighbors, and leave the mask for them. And the bus drivers will be putting out a limited amount at one time. We won't have our whole supply out. So we'll try to manage the abuse. But I got to tell you, people in the city have been, very cooperative and really of good heart during this crisis.
And a couple of questions on Ddot service. One is SMART had announced that they've made some changes. I think stopping commuter lines and going to a reservation-based system, or is the city looking at anything like that? No. And secondarily, there are still some calls for bus service to stop completely.
Right. Ddot is essential to this community, as police, fire, and EMS. If you are a person who can only get to your job at the hospital, can only get to your job at the grocery store, can only get over to take care of your elderly mother or grandmother because the bus is there, this is a critical service. And so the vast majority of our drivers, we had full pull-out today. And so again, I understand that the negative tends to get magnified, but our drivers have been phenomenal. We have had full pull-out in great support, and our drivers know how important this mission is. They know how important they are in their passengers' lives. And so we took steps earlier for the drivers. Now we're taking more steps to protect the passengers, but we've had no conversation about stranding people in their homes and shutting down the service.
Okay. Question on impact to city budget, particularly with the casinos. Numbers are coming out today showing, the revenue numbers, and what does that mean for city operations, basically?
Yeah, I mean, we're going to run a deficit of more than $100 million in this fiscal year that ends June 30th. Now, we've run balanced budgets year in and year out since I've been here. We've never talked about a deficit. We're going to solve it, but there's going to be a point at which we're going to have to talk about cuts, and they're going to have to be painful cuts. We're not going to have to do anything different than every other city and state government's going to have to do. But right now, everything we're doing is focused on the health of our residents. And so it took $400,000 to get to the front of the line for Abbott Labs and those 50-minute tests. And now I've got 450 cops and firefighters back on the job, and we're saving people in nursing homes. We're going to spend what we need to take care of our residents. And then, as a community, we're going to have to deal with the fact that we got a major budget deficit. And I'll worry about that in a week or two. Right now, we got to break the back of this virus.
I think you've addressed this to a degree already, but are you hearing or experiencing any issues on the supply side, particularly as it relates to personal protection equipment?
Yeah, I mean, Hakeem can write a book. He's been the one scavenging it from around the world. Why don't you talk about what's going on?
Well, first, I have to give credit to our procurement department because they have been phenomenal in finding equipment that's helping support our state fairgrounds and relieving that pressure for some of the hospitals as well. We are constantly evaluating how many days and what we call as a burn rate, how far out we have. So we're staying on top of it. So right before this conference started, I got another call about another delivery of masks. And our procurement department and also businesses that have been donating all types of masks, from surgical masks to N95, has really gone a long way in helping to support the mission that we have.
Okay, and last question I've got.
I want to make one more point.
Yeah, sure.
Boise Jackson probably is somebody most Detroit has never heard of, but he's our procurement director. But when I call him up and say, I got to get 5,000 swabs for test kits, and he doesn't really know what the specs on a swab are for a scientific test, and 24 hours later, he's lined up 5,000. This is what he has done for us time after time, and Boise Jackson and that procurement team are really unsung heroes of our response.
Last question I've got right now is from WWJ. Apparently Senator Shirkey announced a work group aimed at transitioning Michigan citizens back to work, and they plan to report to the governor on April 17th. Do you have any concerns about a too rapid return to work?
Again, we have a team working on return to work ourselves. And so I expect the city of Detroit to lead the country in strategies in reopening businesses. Why we're spending so much time on things like our grants programs to small business, the Feed the Front Lines program to help the restaurants keep going and the like. And so we should be thinking through what it's like. So I have one team that's working hard on how we're going to restart government and the economy, and another team that is trying to bend this curve as fast as we possibly can so we can shift to those conversations. So I don't know that April 17th is going to be the restart date. That sounds, based on what I'm saying, very optimistic. But I can tell you, we have teams working on that as well.
Okay, last question.
All right, thank you all